welcome members to my last interview in our series, Remote Reflections, Dermatologists in Action. And it's my great pleasure today to welcome Nicole Maillet-Lebel as our New Brunswick representative. Welcome, Nicole.
Thank you. Thanks for the invitation.
And Nicole is our incoming newly voted vice president to the CDA board. So I congratulate you for that new position as well.
Thank you. Very
So
honored.
Nicole, yeah, we're excited to have you. So please tell us a little bit about yourself and where you practice.
So I am a fully medical-based dermatologist here in Moncton in New Brunswick. After completing my residency in 2018, I only opened my practice in January of 2019 because I had my first child after residency. So I offer a full range of medical dermatology from pediatrics to older patients, and I do a little bit of surgery. We offer different services in the clinic like phototherapy, PDT, so really a broad-based medical dermatology practice.
Oh, amazing. And so you don't really work in what we would call a rural area of New Brunswick, but you likely do have some insights about dermatology services across your province. So can you tell us a little bit about that?
So yeah, in Moncton per se, it's considered one of the biggest and most rapidly enlarging cities in Canada. But we do have patients that come from remote areas. They travel to Moncton to come and see a dermatologist. We have dermatologists a little bit throughout the province, but I say the hub of it is St. John and Moncton. So we do have to factor in that rural aspect that patients will be coming from elsewhere.
I mean, the province isn't so big, but there's probably transportation issues. Like, how long would it take some patients to travel to a dermatologist? What would be the range?
So it can vary from 30, 40 minutes to up to 4 hours. There are patients that are traveling from the northern part of the province to Moncton, and there's no great bus system or train system as we have in other areas in the country. So it's mostly all by car. It's not by plane. It can be
Mhm.
time consuming for some patients.
And with the three, I only just learned this today because I looked it up, that Moncton is the largest, general Moncton is the largest community, but you've got St. John's and Fredericton. Do people practice outside these three hubs in New Brunswick or not really?
There's a dermatologist in Bathurst, and we have a newer dermatologist practicing in Edmundston, I think part-time. And from what I've recently heard, I think we have a new dermatologist or somebody coming in Miramichi. So the rural areas are starting to be a little bit better served, but we definitely could benefit from more dermatology services, more in the northern part of the province.
Is there enough of a population to warrant someone setting up a practice outside of some of these
I
hubs?
definitely think the northern part of the province, there would be room for more physicians because we see them in Moncton. And I think my colleagues in St. John and Fredericton are also seeing these patients.
So do you feel that dermatology is well serviced in New Brunswick at the moment? Or what are
I
your
think
wait
there's
times
still
indicate?
the wait times have been very long. I think it's getting a little bit better. We had 4 new dermatologists start in the last 6 to 9 months, so it's
Wow.
getting better. Wait times were about maybe 2.5 years for the last 2, 3 years, so it was very long. So I'm very hopeful that it's going to be better with all these new dermatologists starting.
Oh, that's amazing. That's good to hear. And what draws people to New Brunswick? What brings people to your province?
I think it's the fact that we have, the East Coast air, the salty air, the beaches and the ocean really close by, fresh seafood. We have really nice environment. There's trees, there's beaches. The community is very welcoming. Patients are very friendly. They're very open to discuss with you. I think it's just the community as a whole. They're very welcoming.
Oh, that's beautiful. Yeah, good reason to come.
Yeah.
So, given those challenges to your weights, probably complex patients arriving unexpectedly throughout your clinic, how do you manage complex patients, given such a busy practice with long wait times?
Yeah, so I feel like I kind of fall back to residency when I have complex cases. Like I'll sit down, I'll go to PubMed, I'll go to UpToDate, I'll read publications, I'll reach out to colleagues to discuss these complex cases. When we have local meetings, we'll bring hard cases to discuss. Sometimes I'll send them out of the city to see some of my other colleagues so that they can take a look at them and repeat some of the workup, and then we'll work together on these complex cases. But it's been kind of nice in a way to stay connected and try and keep up with the literature. And I'm
Mm.
often honest with my patients when it's complex. I'll tell them, I'm not really sure, you're more of a complex case. And they're very understanding and they'll follow along with us as long as they know that we're not trying to hurt them. They know that we're trying our best. And I think it's just to be open with these patients. So it's been eye-opening to have those communications and open discussions with those hard
Just
cases.
setting the expectations, right?
Yeah.
So that they understand the path as you imagine it unfolding as well. How
Yeah.
far are you from an academic center if you need that level of engagement?
So I would say the where there's residence and real academic center would be in Halifax with
Mm.
Dalhousie. In Moncton, we have like family medicine programs and internal medicine residents coming through. But there's no dermatology center in Moncton other than us working individually in each of our practices.
So in your community and the broader New Brunswick community, what are there any services that you find lacking that could be better developed to support our dermatology patients?
There's definitely work to be done. I think improving that corridor of service with that university center in Halifax, maybe we could work on that a little bit more. But my colleagues have always been very open to seeing those patients. So I don't think it's from a lack of availability. I think it's just we forget to maybe reach out to those centers.
Mhm.
Um, but in a whole, I think we're doing our best, like everybody else in the country, trying to offer the best service that we can. There's definitely
How's
stuff
your
that
subs?
we can.
Sorry, how is your subspecialty services in New Brunswick?
We have three Mohs surgeons in New Brunswick, two in St. John, one in Moncton. So that part's
Great.
good. We all, or most of us, offer patch testing. Here in Moncton, I'll offer patch testing for two of my colleagues in St. John and Fredericton. So we've teamed together for those. There's some surgical excisions I'll send to plastic surgery. So I've extended those services to other colleagues as well. I think we kind of reach out to who has the best expertise, and we now have a new dermatologist who started last fall, Dr. Giberson, who's doing de-roofing for HS on some of our patients. So I'm hopeful that our services will get a little bit better as time goes and as we get to know our new colleagues and see what everybody likes to do.
Right. Yeah. Everyone has their little niche.
Exactly. And we have to use those niche and kind of connect with each other and see what we're good at.
And how is it in New Brunswick for other specialties like rheumatology, infectious disease, like those other pieces that we have to bring together sometimes?
So you definitely have to make those connections when you get here. So there are plenty of rheumatologists and infectious disease. We have all those specialties here. I say the main one that's lacking is immunology and allergy. We don't have an immunologist here. Um, but we've made those connections. I think there's wait times just like across the country for those specialties. But I feel like when we pick up the phone and say we really need help for specific cases, that can be accelerated. And I've had good support from the rest of the community as well.
And how have technologies been useful to you in your practice? Like, I mean, even just virtual care, how has that melded your practice as it serves some of these remote patients?
So I definitely think it's been a helpful tool, especially for those patients who are traveling from far away. In my early part of my practice, I was seeing everybody in person. So even biologic follow-ups were doing well. And so people would travel 4 hours to see me just to tell me they were doing well. So I think for those patients, those virtual phone calls have been very helpful. I'd say most of our dermatology clinics have EMRs and we're using them to be more efficient. I was very fortunate to have private investors allow me to purchase the first 3D mole mapping system in Canada. So we installed it and opened to the general public in January. So we're hoping to be able to offer mole mapping as like general screening for patients that we're not following actively to help detect early skin cancers. So I think in a whole, we're using technology to the best that we can, just like everybody else in the country.
Interesting. That's really fascinating. That's something we should learn more about when we compare across provincial models. That's fascinating. Okay, for another conversation. What sort of incentives do you think, be they financial, educational, professional, what sort of incentives would draw people to an underserviced province like some parts of New Brunswick? What do you think?
Well, I found the hardest part coming here was how to set up a practice. So when I first got here, I was offered 2 days of clinic time in the hospital, but they told me I have to have my own receptionist book those patients into the clinic. I need to have my own nurse in an office somewhere to help me manage paperwork. They wouldn't help me do that at the hospital level. So I kind of blindly came into business management and figuring out, how do I hire people? What do I need to do? How do we budget for stuff in the clinic? What do we need in a clinic, and what are we okay not getting in a clinic? So I feel like that part would be helpful, whether it's financial or educational, to know how to set up a practice when you're going somewhere where there are no big clinics that you can just step into and start working. I feel like that was lacking when I opened my practice. I learned a lot. I read books, I went to conferences, I did my best, but it was definitely a challenge. And I feel like I've learned a lot, and maybe it is something that could benefit other people, but that part's a challenge.
Wouldn't it be amazing if a health authority had a business consultant on their books who could offer, say, 50 hours to every new practice that's coming in, right? Just to,
Yes. But
wouldn't that be amazing?
I think our
Yeah.
New Brunswick Medical Society just recently offered that to some of the new physicians coming in. So I wasn't lucky to be part of that group when I first arrived, but I think they are offering it. So I'm not sure if it's something they're offering across Canada for rural areas, um, but
That's
yes,
brilliant.
it's
That's really
amazing.
interesting. Huh. Yeah. Again, things we need to share across provinces, things that work well in one and we can advocate for another. So interesting.
Absolutely.
So, what advice would you give to dermatology residents if they were considering practicing in a smaller community or even a rural community?
I would say do it. Try and reach out at least to those communities, see what it's going to look like, see what it's going to take. The health authorities might be willing to help out, and they might have more clinic time or services available. I think these rural areas and underserved areas definitely need a dermatologist, and it can be very fulfilling to see all those complex cases and keep you, learning new things and being humbled by those complex cases that you're not sure what to do with. It's a challenge, but it can definitely be a positive challenge.
That's what I'm hearing over and over is the exposure is the key piece.
Yeah,
And the work might seem a bit daunting and harder, but it's also incredibly gratifying to make that
absolutely.
kind of a difference. Yeah, for sure. So what do you think the CDA could do to further support smaller communities where dermatologists are feeling a little isolated? Any ideas there?
So I actually appreciate those virtual webinars and conferences and having guest speakers. I think is a great way for us to stay, informed about all these issues. I've done maybe one virtual journal club one. I don't even know if they're still available, because the timing when I had done it, it was so hard to do that you guys are trying to connect the whole country at the same time.
True.
And in Atlantic, it means it's really late for us. So I
Mhm.
like the journal club aspect and the fact that it was, directed discussions on different articles, but maybe it should be divided per different time zones or to help us connect. And maybe providing support, whether it be, educational on how to develop a business model, how to open a clinic, what do you need to consider to set up practice in a rural or an area that's underserved. Those could be areas that could be beneficial from CDA.
I've even thought like a supply list. It's so difficult to even come up
Yes,
with a supply list because you're
yes,
vetting every single item, which is so
yeah,
time consuming.
yeah. Even like a punch, like which one's good? Where do you get it? How much does it cost?
So
Yeah,
true. Yeah, a lot of pieces there. So
absolutely.
finally, what is it about your community that you just love? What do you love about New Brunswick? You told me a couple of things, but is there anything else that you feel would be a promotional statement regarding practicing in New Brunswick?
So we definitely don't have long commutes to work. There's no traffic. You can hear the birds singing in the morning. I think we have, our cost of life is quite low compared to other cities. We're really lucky to be in New Brunswick, and it's a bilingual province. You can speak French or English, um, and the community is very welcoming, as I mentioned earlier.
Interesting. And what percentage of your patients would be exclusively preferring French for communications in their medical interactions?
So in Moncton, I'd say most francophones understand English. So about 50-50 will choose to speak English or French. When I have patients coming from the northern part of the province, they'll prefer speaking French. People in
Hmm.
the southern part of the province, a little bit more Anglophone. So, but I'd say in my practice, it's a bit 50-50.
So interesting. It's good to know for people considering New Brunswick. French will definitely be an asset. It sounds like for sure.
Absolutely.
Yeah,
Yeah.
yeah. Lovely. Well, thank you so much for joining us today. It's lovely for you to meet you and for the greater community to meet you. And we look forward to seeing you in Halifax really soon.
Thank you.